Hello everyone. Today, we're delving into the world of a medication called clonazepam, commonly known by its brand name, Klonopin, and its generic name, Clonazepam. As always, this discussion is intended for educational purposes only. If you have health-related questions or concerns, it is essential to seek guidance from a qualified medical professional. Description: Clonazepam, known by both its generic name clonazepam and its brand name Klonopin, is an oral medication classified as a benzodiazepine. Its primary function is to affect certain chemicals in the brain to help control and prevent seizures and to manage symptoms of panic disorders. Clonazepam has been approved by the FDA and is commonly prescribed for epilepsy, particularly for individuals who experience certain types of seizures. Additionally, it is used to alleviate symptoms of panic disorder, including sudden and recurrent episodes of intense fear or discomfort, often accompanied by physical symptoms like palpitations, sweating, and trembling. Warnings: Clonazepam comes with important precautions and considerations. It should not be used by individuals who have a known allergy or hypersensitivity to clonazepam or other benzodiazepines. This medication is not recommended for those with a history of substance abuse or addiction, as it has the potential for misuse and dependence. Before taking clonazepam. Prior to initiating clonazepam treatment, it's crucial to discuss your medical history and current medications with your healthcare provider. Inform them if you have a history of any respiratory conditions, glaucoma, liver disease, kidney disease, or a history of depression or suicidal thoughts. Clonazepam may not be suitable for individuals with certain medical conditions, so it's essential to have an open and thorough conversation with your healthcare provider. You should also notify your healthcare provider if you are pregnant, planning to become pregnant, or breastfeeding, as clonazepam may pose risks to the developing fetus or nursing infant. Your healthcare provider will weigh the potential benefits and risks in such cases. Side effects: Like all medications, clonazepam can cause side effects. Common side effects may include drowsiness, dizziness, increased saliva production, or changes in appetite. Some individuals may experience more severe side effects, such as confusion, mood changes, difficulty speaking, memory problems, or uncontrolled movements. It's important to be aware that clonazepam, like other benzodiazepines, has the potential for habit forming and should be used as directed by your healthcare provider. Abruptly discontinuing clonazepam can lead to withdrawal symptoms, so any changes to your dosage should be made under medical supervision. Interactions: Clonazepam can interact with various medications and substances. Inform your healthcare provider about all medications, including over-the-counter drugs, supplements, and herbal products, that you are currently taking to avoid potential interactions. Dosage: Adherence to the prescribed dosage is crucial when taking clonazepam. Your healthcare provider will determine the appropriate dose based on your medical condition and individual response. It's essential to follow their recommendations closely and not to adjust your dosage without consulting them. Avoid: While using clonazepam, it's advisable to avoid activities that require mental alertness, such as driving or operating heavy machinery, until you understand how the medication affects you. Additionally, alcohol should be avoided, as it can enhance the sedative effects of clonazepam and increase the risk of adverse reactions. FAQ: Some individuals may wonder about the age restrictions for clonazepam. Generally, it is not recommended for use in individuals under the age of 18 unless specifically prescribed by a pediatric specialist. Closing: That concludes our overview of clonazepam, known as Klonopin. Remember, this information is intended for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.